Have you ever turned 60 and felt like your doctor is trying to treat your body as if you were still 20? It's an extremely common situation. You go to the appointment, you feel good, you have energy, but the moment you open your blood test results, the doctor throws his hands up because your cholesterol went up a little. From that point on, there's enormous pressure to lower that number at any cost, often without considering that your body today has completely different needs than it did decades ago. The truth is that after 60, the rules of the game change. That obsession with chasing an extremely low LDL can, ironically, be stealing your memory, weakening your muscles, and undermining your vitality. Cholesterol is not a villain that shows up with age to attack you. It's the essential raw material for your brain and for producing your hormones. Today, I want to show you what really changes in your metabolism after age 60 and why the yardstick for measuring your health needs to be different if you want to live with independence and mental clarity. Driving your cholesterol too low at this stage of life can come with a high price that nobody told you about. Hi, I'm Dr. Harrison Blake. I'm a medical specialist, and in my 15 years of clinical practice, I've learned that medicine for people who have reached their best years requires wisdom and personalization, not just blindly following rigid computer protocols. If you want to protect your heart without sacrificing your quality of life, you're in the right place. Go ahead and hit that like button, subscribe to the channel, and leave a comment below. What's your age and what's your biggest fear when it comes to cholesterol? I make a point of reading every single story. Did you know that your brain, even though it makes up only about 2% of your body weight, contains roughly 25% of all the cholesterol in your body? That's right. The brain is the fattiest organ you have, and that fat is there for a reason. Cholesterol acts as electrical insulation for your neurons, forming what's called a myelin sheath. Think of the electrical wires in your house. If you strip away the plastic coating that protects them, you start getting short circuits. In your brain, cholesterol is that protective coating. Without enough of it, communication between nerve cells becomes slow, faulty, and degraded. In my 15 years of medicine, I've seen a disturbing pattern. Patients over 60 who start aggressive cholesterol-lowering treatments often begin complaining of brain fog, lack of focus, and memory lapses. Many times this gets brushed off as normal age-related decline, when in reality it could be the brain suffering from a lack of raw material. The brain produces a good portion of its own cholesterol, but it depends on overall systemic balance. When we force cholesterol to artificially low levels, we impair synaptogenesis, the brain's ability to form new connections. For anyone over 60, preserving cognitive integrity should be priority number one. Long-term observational studies suggest that older adults with slightly higher cholesterol levels tend to perform better on memory tests and have a lower incidence of dementia than those with very low cholesterol. This happens because cholesterol is also essential for the health of brain cell membranes, protecting them from oxidative stress. If you dry out the fat in the system too much, you leave your neurons vulnerable. We also need to talk about neurotransmitters. The signaling of serotonin and dopamine, the hormones of well-being and motivation, depends on the fluidity of cell membranes, which is largely determined by the presence of cholesterol. That's why it's not uncommon to see depression or apathy in older adults whose cholesterol has been driven way down. My job as a doctor isn't just to look at your heart. It's to make sure your central computer keeps running at full speed. So when we look at your labs after age 60, my criteria change. I don't want your LDL at pediatric levels. I want it at a level that protects your gray matter. Protecting the brain means protecting your identity. And to do that, we have to respect the biological need your nervous system has for quality fats. If we want longevity, we need an armor brain, and cholesterol is the main worker on that construction site. One of the most common questions I hear in the office from patients who just turned 60 is, "Doctor, I haven't changed anything in my diet. Why did my cholesterol shoot up?" The answer isn't in what you're putting on your plate. It's in a profound change that happened in your hormonal control panel. We need to understand that cholesterol is the mother molecule for almost all our steroid hormones. It's the basic raw material your body uses to make testosterone, estrogen, progesterone, and even cortisol, which helps us handle stress. When women go through menopause and men go through andropause, production of these hormones drops dramatically. Picture your body as a furniture factory and cholesterol as the wood. Suddenly the demand for furniture, hormones, drops sharply because the factory is changing its pace. What happens to the wood that keeps arriving every day? It starts piling up an inventory. That's exactly what's happening in your blood. The rise in cholesterol after 60 is often simply the result of a body that is no longer consuming that raw material at the same rate as before. Cholesterol piles up because the hormonal production line has slowed down. In my 15 years of medical practice, I've observed that many professionals interpret this increase as a sudden disease when, in reality, it can be a physiological adaptation. In women, estrogen plays a fantastic protective role in the liver, helping keep LDL receptors active and efficient. When estrogen drops after menopause, the liver naturally becomes a bit slower at clearing cholesterol from the blood. That doesn't mean you're in immediate danger. It means your lipid profile is adjusting to a new phase of life. Trying to aggressively force that number down right after this transition can deprive your body of the few hormones it's still trying to produce. We also have considered DHEA and pregnenolone, the hormones of vitality and memory, which are also derived from cholesterol. After 60, maintaining adequate cholesterol levels may be the way your body ensures production of these youth hormones doesn't completely bottom out. There's biological wisdom in that. The body knows that to keep skin intact, bones strong, and the mind active, it will need an available fat reserve. Another crucial point is the relationship between cholesterol and the immune system. After 60, our defense system needs more support. LDL has a little-known function of neutralizing bacterial toxins and helping fight infections. That's why, in older adults, a slightly higher cholesterol level can actually be a protective shield against pneumonias and other seasonal illnesses. What conventional medicine calls high cholesterol in maturity, I prefer to call resilience reserve. So before you panic about an LDL rise at 60 or 65, look at the big picture. If you're maintaining muscle mass, your mind is clear and your energy is good, that increase may simply be your body managing inventory in a factory that's now operating more strategically. My goal as your doctor isn't to fight your nature, it's to make sure this hormonal transition happens in balance, protecting your arteries without stealing the raw material for your vitality. In my 15 years of medicine, what concerns me most after 60 isn't just cardiovascular event risk. It's the risk of sarcopenia, the accelerated loss of muscle mass and strength. And here we need to have a very honest conversation about the relationship between cholesterol and your muscles. Cholesterol is an essential component of the membranes of every cell in your body, including muscle fibers. Without stability in those membranes, muscle becomes fragile, prone to micro tears, and recovers very slowly. The big problem arises when we introduce medications to aggressively lower cholesterol without considering the patient's age. Statins, the most prescribed drugs in the world for this purpose, work by blocking cholesterol production in the liver. The issue is that they don't just block cholesterol, they block an entire metabolic pathway that's also responsible for producing coenzyme Q10, CoQ10. CoQ10 is a fuel for your mitochondria, the tiny power plants inside your cells. For a 20 or 30-year-old, this reduction might be tolerable. But for someone over 60, those power plants are already not running at full capacity. When you reduce CoQ10, your muscles start to fail. That's why so many older adults who start cholesterol meds begin complaining of leg pain, weakness climbing stairs, or fatigue that never goes away. In more severe cases, this leads to myopathy, where the muscle literally begins to break down. Imagine the danger. An older person with less muscle strength is more likely to lose balance and fall. A fall after 60 can result in a hip fracture, something that dramatically changes life expectancy and quality of life. So when treating cholesterol in maturity, we have to weigh, does the benefit of lowering a lab number justify the risk of you losing the strength to walk or the stability to avoid falling? Many times, the answer is a resounding no. Cholesterol is also fundamental for synthesizing vitamin D in your skin through sun exposure. As you know, vitamin D is crucial for bone health and muscle function itself. If you crash cholesterol too low, you impair that whole support system for your body. I see patients whose cholesterol is perfect on paper, but who can no longer get up from a chair easily. That's not health. That's treating a lab result while neglecting the human being. My focus with patients over 60 is preserving function. I prefer a patient with an LDL slightly above the traditional target, but who lifts weights, walks confidently, and has strong muscles, over a patient with an LDL of 70 who is bedridden and in chronic pain. Cholesterol is the cement that keeps your body structure solid. In maturity, your physical strength is your greatest life insurance, and we need to make sure heart treatment doesn't become the enemy of your movement. There's a phenomenon in the medical literature called the cholesterol paradox in the elderly. In my 15 years of practice, this is a concept that brings the most relief to my patients. Multiple large-scale studies around the world, including data from Japan and several European countries, show something counterintuitive. In people over 60 or 70, having a slightly higher LDL cholesterol is often associated with longer life and lower all-cause mortality. Yes, you heard that correctly. What was a danger at 30 seems to become a life insurance policy in maturity. Why does this happen? First, because cholesterol is a vital component of your immune system. After 60, the body becomes more susceptible to infections like pneumonia and urinary tract infections. LDL can bind to bacterial toxins and neutralize them before they cause greater damage. Older adults with very low cholesterol tend to have more fragile immune systems. Second, adequate cholesterol levels protect against physical frailty and cancer, threats that are far more real at this stage than a sudden artery blockage in vessels that have stayed clean for 6 decades. So if the cholesterol number is no longer our main enemy at 60, who is the real villain? The answer is chronic inflammation. That's why I always tell my patients, stop looking only at LDL and start looking at your C-reactive protein, CRP, and your homocysteine. If your arteries are calm, without inflammation, cholesterol can circulate freely without causing problems. It's just a passenger. The real danger comes when that passenger encounters a sticky, inflamed arterial wall. It's inflammation that causes cholesterol to oxidize and turn into plaque. If you're 65 with an LDL of 160 but a very low CRP and an active lifestyle, your risk may be much lower than someone 40 with low cholesterol but high inflammation. Another marker we often ignore is fasting insulin. If your insulin is high, your body is in a state of metabolic stress that damages vessels. In maturity, the flexibility of your arteries is far more important than the fat floating in your blood. That's why tests like the coronary artery calcium score or carotid ultrasound are much more valuable after 60 than an isolated lipid panel. They show the real damage, not just theoretical probability. If your arteries are clean after 60 years of use, why would your body suddenly start clogging them now just because the number on paper went up 10 points? Understanding the cholesterol paradox is about regaining peace. It's understanding that your body is trying to protect you and that cardiovascular health in the third age is about resilience, not about matching lab numbers from a 20-year-old. My goal isn't to get you within range of the guidelines. It's to ensure you have the biological reserve needed to face the challenges of aging. When we focus on lowering inflammation instead of just lowering fat, we're treating the root cause and ensuring true quality longevity. If your body after 60 is that classic car, the type of oil and fuel you use makes all the difference. The first mandatory item in my longevity protocol, especially if you're already on statins, is coenzyme Q10. As I explained, cholesterol medication hijacks production of this substance that's the battery of your cells. Supplementing 100 to 200 milligrams of CoQ10, preferably in ubiquinol form, can be the game changer between living with muscle pain and fatigue or regaining the vitality to play with your grandchildren and take your daily walk. It's the nutrient that ensures your heart and muscles keep having energy to contract. The second essential ally is vitamin K to -7 Malawian kwaches. If high cholesterol worries you because of clogging risk, K2 is your best friend. Think of it as the traffic cop for calcium. The biggest danger isn't fat in the artery. It's calcification, which makes the vessel rigid. Vitamin K2 removes calcium from where it shouldn't be, your arteries and heart valves, and directs it where it's needed, your bones. This prevents both heart attacks and osteoporosis. For anyone over 60, flexible arteries are far more important than a low LDL. We can't forget omega-3s. But here, dose and quality matter. After 60, omega-3 acts like a firefighter, putting out that silent inflammation, high CRP we discussed. It improves blood fluidity and supports retina and brain health. But the secret for maturity is focusing on nutrient density. Prioritize good fats like olive oil and avocado, which provide protective polyphenol. Olive oil specifically helps keep HDL, the cleanup crew, functioning well, even when hormonal production has dropped. Nutrition focus also has to shift. At 30, you focus on calories. At 60, you need to focus on protein and fiber. Protein is what holds your muscles against sarcopenia, and soluble fiber, like psyllium, is what helps your liver eliminate excess cholesterol naturally through bile, without aggressive chemicals. In my 15 years of practice, I've seen that small adjustments bring big victories. It's not about a restrictive diet that takes away the pleasure of eating. It's about strategic supplementation that returns to your body what time and medications took away. When you supply CoQ10, vitamin K2, and anti-inflammatory fats, you're armoring your system. You stop being a patient fighting diseases and become a person cultivating health. The goal is to reach 80, 90 years old not just with good lab numbers, but with autonomy, strength, and a sharp mind. We've reached the end of this conversation, and what I hope is clear to you is that aging is not a process of breaking down. It's a process of adaptation. In 15 years of medicine, I've learned that the biggest disease affecting people over 60 is fear. Fear of a lab number, fear of eating what you love, fear of losing health. But now you know, cholesterol is not your mortal enemy. It's the fuel for your brain, the structure of your muscles, and the foundation of your resilience. Starting today, your goal isn't to have the labs of a 20-year-old. It's to have the health of a 60-, 70-, or 80-year-old who is strong, lucid, and independent. When your doctor talks about cholesterol, ask about your inflammation, your muscle strength, and the health of your arteries. The focus is function, not just a fiction of numbers. I'm Dr. Harrison Blake. If this video brought peace and clarity to your heart, share it with your friends and family who are also in this stage of life. Drop a like, subscribe, and comment below. I choose vitality. A big hug, and see you at our next meeting.